Okay. It's morning, everyone.
Morning.
Okay, I hope everyone is well. I hear that the weather was quite hot the last few days.
Yeah. Just now it just rains.
But I was freezing up there in Dharamsala. Okay, so tonight's talk is glutathione and mental health. So first we need to revise on what is glutathione before we go into its role in mental health. Okay, for many years, glutathione is famous as the master antioxidant or the superhero of antioxidants, but that is not its only functions. And this glutathione is produced naturally within the body and is in every cell. And as you will discover, that it is very important for all the organs, though for this session we are concentrating on the brain, since we are talking about mental health. Okay, this is the glutathione molecule, and GSH is the chemical short form, and the G refers to the bulk of the molecule, whereas the SH refers to that two atoms, the yellow sulfur atom and the white hydrogen atom. So the rest is G. So when we go into detail on how active or reduced glutathione becomes oxidized and then becomes recycled to become reduced again, then you will see the role of this G and SH. Okay, what are the major functions of glutathione? As mentioned earlier, for decades, it was already known that it is the most important antioxidant for the cells, intracellular antioxidant. But if it's the most important for the cells, must be the most important for the organs and most important for the body. It is also a very powerful anti-inflammatory agent, a very powerful immune booster modulator, a very powerful detoxifier, a versatile signaling molecule, and many, many, many more functions. Now, it's difficult to escape and to have any system in the body where glutathione is not involved. So let's go into brain health. Let's talk about what we mean by cognitive functions first, so that we understand, when you have a mental problem, that means, that means your cognitive functions are affected. So what do we mean by cognitive functions? These are conscious intellectual activities such as thinking, reasoning, or remembering that enable normal daily life. And cognitive functions gradually decreases with aging without affecting normal daily life. Well, you all know some of the, we tend to start getting forgetful as we age, for example, and even our hearing affected, our eyesight affected. But there is more rapid decline leading to moderate to severe impairment when you have neurodegenerative diseases, all right, which is distinct from aging. And then you may have sudden and variable decline in the cases of injuries, stroke, and brain tumors. And when you have mental or psychiatric disorder, it means that there is a significant disturbance in cognition, emotional regulation, or behavior. So when we say someone has a mental disorder or psychiatric disorder, we mean at least one of these areas is affected: the cognition, emotion, and behavior. Okay, and what are the types of brain disorders or diseases that can happen? And they all will have some impact on your overall mental health. You may start with, for example, atherosclerosis or stroke, but later on, or even from the beginning, sometimes immediately the mental health is affected. For some, it's just the physical aspect, but the mental function is still intact. So there are the cerebrovascular diseases which for most people may be responsible for what we see in aging, because slowly, the blood supply is also affected. Then you have the neuropsychiatric dysfunction, where the brain structure appears normal, but there's probably dysfunction or disorder or imbalance or deficiency or excess of certain chemicals, neurotransmitters. And then you have the neurodegenerative diseases, which can be seen as accelerated aging. You know, aging too fast, that what is normal aging is distinct from what are called neurodegenerative diseases. And these include Alzheimer's disease, Parkinson's disease, and ALS. Okay, so tonight we'll just focus on the neuropsychiatric dysfunction. Okay. So studies have shown that low levels of glutathione in the brain are linked to a number of psychiatric disorders. And the studies show that high levels of oxidative stress have been identified in the brains of patients with a variety of chronic illnesses. So when you have high levels of oxidative stress, then antioxidants, especially glutathione, is consumed in trying to fight the oxidative stress. And glutathione, remember, is the main protector of your brain and also of all the other organs in the body. Studies also show that increasing brain glutathione can help reduce this oxidative stress and protect the neurons or the nerve cells from oxidative damage. And studies show that boosting glutathione synthesis, that is, making more glutathione, also reduces glutamate, which is a major excitatory neurotransmitter in the brain. That means it causes excitement in the neurons that can lead to overstimulation. By reducing glutamate also improves the response to whatever treatment the psychiatric patient may be taking. Note that glutamate, or most of you probably will be more familiar to the acid form, the glutamic acid. Glutamate is the salt form. Okay, glutamate or glutamic acid is a glutathione precursor and is used in the synthesis of glutathione. So you can see boosting glutathione has benefits the brain as far as psychiatric disorders in two ways. One, then you have more glutathione, then through all its function of being antioxidant, anti-inflammation, detoxifying, etc. So it keeps the brain healthy and maybe reverse some problems. At the same time, it reduces the level of glutamate because the glutamate is a raw material, is a precursor to make, one of the precursors to make glutathione. And glutamate, excess glutamate is harmful for the brain. Okay, so there's a background on how glutathione may help. So what are the mental problems or illnesses that have been studied and found that glutathione can help in reducing these problems or reversing these problems? Okay, these include anxiety, major depressive disorder, bipolar disorder, drug addiction, obsessive compulsive disorder, autism and ADHD, schizophrenia, Alzheimer's disease and other forms of dementia, certain forms of epilepsy, and even traumatic brain injury. Okay, so there's a whole range of mental or psychiatric illnesses, disorders that can be helped by boosting glutathione. A study of people experiencing a first episode of psychosis has shown that higher levels of glutathione are associated with quicker responses to treatment and may improve early intervention outcomes. I will explain a bit about psychosis. Most of you, excuse me. Most of you are familiar with the word psychiatric problems, psychiatric disorders. But it's good to know the difference between neurosis and psychosis. right? Somebody you say somebody is neurotic and somebody is psychotic. Okay, neurosis in the simplest term or explanation is an exaggeration of what would be a normal reaction in a normal person. For example, many of us also don't like itchy bitchy with a caterpillar, right? But somebody there are people who you just see a caterpillar will faint. All right, okay, yeah. So it's an exaggerated response. What is normal? Okay, most of us do care about cleanliness. We do wash our hands. But those with obsessive compulsive disorder, right, they're washing their hands every second. So, right, that is an exaggeration of a normal behavior. But it's still linked to normal behavior. Whereas psychosis, right, is like not walking on the ground. Somebody is disconnected with the reality. All right, one day say, okay, I am God. All right, that's already psycho. Right, there's no more neurosis. Psychosis can be a symptom of a number of psychiatric disorders, including schizophrenia and schizoaffective, bipolar, major depressive disorders. In fact, many who have among the list the earlier on I gave. So many of those will include having symptoms of psychosis. And then the studies show that the time it takes for somebody to respond to treatment for psychosis is a key indicator of their long-term outcome. Meaning, if somebody is psychotic, the earlier they improve, the better chance. The shorter will probably be the illness. The longer it takes to improve, then more chance of being chronic and long-term. However, doctors have yet to fully understand why some people respond to antipsychotic treatments within weeks, while others take months. Well, the development is that now further studies have shown higher levels of glutathione that were associated with quicker response to treatment, suggesting that boosting the amount of glutathione in the brain could improve outcomes for people experiencing psychosis. You see, I had retired from delivering babies and treating infertility and all that before I became a medical advisor for Max. And because after becoming medical advisor, even though I thought I knew a lot about glutathione, I had to read a lot more, right, to really know about the stuff. And I discovered many things which, if only I knew when I was obstetrician, it would have helped, right, my patients and the babies. But I do not think, even now, the obstetricians are using that knowledge. Why it reminds me of that is because I do not think right now the psychiatrists are using this knowledge. The research is there, okay? But we also know the reason why, because this is not a drug, right? If it's a drug, it's a patented drug, then the drug company will make sure, one thing, bigger studies are done and make sure every doctor will know about it, okay? But many people are suffering from mental problems. Many people are suffering from mental problems, right? And these studies show that boosting glutathione can help. And even if they need the drug treatments, these studies show that boosting glutathione will help them respond faster to the drugs. Okay. Then we have especially mentioned about autism, because autism starts in childhood. Yeah, and you miss this time, no, they have a whole lifetime of being autistic, right? But if you intervene when they're young, even if you cannot cure them, if you can improve them, then there are many more years of benefit in future. Studies have shown that patients with autism exhibit high levels of oxidative stress and inflammation, especially in the context of the brain, and the cellular damage caused by oxidative stress and inflammation may contribute to the autism spectrum disorder. This may in part be attributable to the fact that production of glutathione is typically either impaired or otherwise inefficient in patients with ASD. And studies show that many autistic patients have defective genes related to one or more enzymes of the glutathione system. Again, I do not know whether the professionals taking care of autistic children are taking advantage of this knowledge. Autism is also associated with autoimmunity and the lack of immunoglobulins, which cause neural inflammation that correlates with the severity of symptoms. Glutathione can improve autoimmunity, and this aspect may explain improvement of symptoms beyond the antioxidant and anti-inflammatory actions. Another problem with autism is toxicity is a well-known risk factor, and glutathione is the body's main detoxifying agent, used by the liver, kidney, and all organs to neutralize various toxins and contaminants, especially heavy metals. So some doctors who are aware of this, they actually use glutathione as part of their therapy for autism. So fighting oxidative damage, high glutathione levels may help prevent the following complications of autism, that is epilepsy. About 1/3 of people with autism eventually develop epilepsy, and glutathione can help reduce that. Glutathione can help reduce anxiety, depression, and reaction to medications. Okay. Similarly, for schizophrenia, studies show a direct correlation, right, with schizophrenia and decreased glutathione levels. Glutathione may slow down the progression and even lessen the side effects of the drugs given to treat this disease. So I just mentioned autism and schizophrenia, but the same applies. Yeah, I don't want to go into detail with every of those mental illness, but the same applies to through the range of mental disorders listed earlier on. Now we move on to this group of diseases: atherosclerosis, cerebrovascular disease, and stroke, which have a physical cause. But now we are looking into the fact that when you have these diseases, then your mental functions are affected. So progressive narrowing of the carotid and cerebral blood vessels lead to reduced blood supply and progressive shrinkage of the brain, estimated to be 1% per year after age 50, and may be more prone to TIAs. And severe narrowing can lead to ischemia or ischemic stroke, and the burst blood vessel will lead to hemorrhagic stroke. And glutathione can help rescue the damage from stroke, either cause, provided it's given early before the permanent damage. Once a stroke occurs, there is severe oxidative stress in the affected region. Untreated, this leads to extensive and possibly permanent brain damage. Immediate IV glutathione has been shown to protect the brain tissue from oxidative damage and prevent long-term sequelae. Continued boosting of glutathione is expected to hasten recovery, and having healthy levels of glutathione at the time of stroke may possibly reduce the severity of oxidative damage. Okay, since we know it's so important, why not make sure it's there, it's high all the time? Yeah, if you're going to get a stroke, then the high level of glutathione will protect you to some degree. But remember, ask your doctor, please get me IV glutathione. Then this group of diseases called neurodegenerative diseases. Again, it is cumulative oxidative stress, disrupted mitochondrial respiration, and mitochondrial damage that lead to these disorders, including Alzheimer's disease, dementia with Lewy bodies, Parkinson's, and even schizophrenia. These changes to a lesser degree could also be responsible for the decline in cognitive functions in normal aging. Okay, sometimes it could be the same thing, but in a mild, you say, okay, he's just aging. If it's severe and it's obvious the behavior has changed, then you say, oh, this fellow has got dementia, or depending on what is found, it might be even Parkinson's, Alzheimer's. Okay, so what's the difference between just dementia and you see somebody has Alzheimer's? Dementia is an overall term used to describe symptoms that impact memory, performance of daily activities, and communication abilities. It is not part of normal aging, okay? Normal aging, you should still be able to function normally. Alzheimer's disease is the most common type of dementia. Alzheimer's disease gets worse with time and affects memory, language, and thought. And while younger people can develop dementia or Alzheimer's disease, the risk increases with age. People can have more than one type of dementia. This is called mixed dementia. Often people with mixed dementia have multiple conditions that may contribute to dementia. Diagnosis can only be confirmed in autopsy. Too late. Okay. So there are efforts to use glutathione as a therapeutic strategy in Alzheimer's disease. Okay. And the studies have shown that glutathione is the most, we know that it is the most abundant antioxidant in the brain, and oxidative stress is a prominent feature of Alzheimer's disease, as it is in all the other neurodegenerative diseases. And elevation of glutathione protects brain against Alzheimer's disease relevant amyloid beta. You know that's a diagnostic of Alzheimer's disease, the plaques, amyloid beta plaques. And elevation of glutathione in brain induces several protective pathways. Okay. If glutathione was a patented drug, much more research would have been done, and glutathione would be prescribed for all Alzheimer's patients. But we know the science. We don't have to wait for the drug companies to decide our fate. Well, we make sure we have high levels of glutathione to help defer, delay, or totally prevent Alzheimer's. And should any of the family members have Alzheimer's, then make sure you help to boost their glutathione levels. Right, there are some of the studies. Okay, then likewise with Parkinson, a lot of studies have been done. And glutathione is shown to be a very promising in helping prevent, delay, and in some cases, reverse Parkinson's disease. Okay. Usually, the current situation is that with Parkinson's, progression can be slowed and symptoms managed with a variety of drugs. But, you know, glutathione does not come into the picture with the doctors treating Parkinson's. When in fact, studies show that in Parkinson's disease, glutathione levels are reduced by 40 to 50% in the dopamine neurons, right? The brain that contains dopamine, which is the neurotransmitter concerned in this issue. And some studies have shown that administering high-dose glutathione intravenously can help improve symptoms in Parkinson's patients. And there are videos on YouTube that you can search. You know, within minutes of IV glutathione, some patients improved tremendously. Okay, there have been trials on IV glutathione. But here we're not talking about IV glutathione. We're talking about boosting your glutathione day to day as a precaution, as a preventive method. But when you have the disease, then you start needing very high doses where it becomes necessary to take IV glutathione. Okay, so 80 to 90% of Parkinson's patients treated with glutathione improve dramatically. Glutathione doesn't raise dopamine level; it allows dopamine in the brain to work to become more effective. Glutathione can increase sensitivity to the neurotransmitter serotonin, which may explain why many depressed Parkinson's disease patients improved so markedly. So it's not just movements, their behavior also improved. In some cases, patients improved so dramatically that the dosage of the medication they take for the disease could be reduced. So again, you can see, we're still talking about Parkinson's, but earlier on I mentioned that studies have shown you increase the glutathione, and those on treatment for anxiety and depression and bipolar and also many other things, they all improve faster by just boosting glutathione. Of course, IV glutathione can be expensive, inconvenient, and associated with potential side effects. So we're talking about why not boost glutathione orally in a more convenient way, at least as a preventive measure, not only to protect you against Parkinson's disease, but a whole list of mental and neurodegenerative problems. You need high sustained level of glutathione to reverse Parkinson's. IV glutathione can give high levels that can result in significant improvements. However, it's not convenient. If high levels can be achieved by oral route, then the treatment can be sustained long term. Sustained high levels may also prevent or delay Parkinson's and other neurodegenerative diseases and slow down aging. Unfortunately, oral glutathione is poorly absorbed too. What to do? How to maintain high levels of glutathione daily, every day, to try to avert not only Parkinson, but also the other neurodegenerative diseases, and also the whole list of mental disorders mentioned earlier on. Okay, so this is the sad part. So we know that glutathione is very important for mental health and for brain health, and we know that if you have developed problems, then boosting glutathione can help recover your health, your mental health, and or at least slow down the progress, or even doesn't prevent it from getting any worse. But naturally, our glutathione levels decline as we age, and our protection, if we just rely on our natural levels, our protection is very low past age of 40. For example, because glutathione declines by 10 to 15% every decade, if we take baseline at age 20, because when you were young, before 20, the production is sufficient. But after age 20, they start to decline as part of our programmed aging. So you have increased oxidative stress, maybe from 20 to 40, you're still maybe okay. But for some people who are not healthy, even at 30, they're not okay. Okay? So it's never too early to start thinking about restoring your glutathione levels. But certainly, definitely after 40, if you don't do, you're going to be exposed to many problems. So with the declining glutathione levels, you have increased oxidative stress, you have increased inflammation, you have increased toxicity, you have decreased immunity, and many, many more problems. Okay, to have an idea of what is expected in your glutathione levels as you age, if 20 years old is taken as a baseline 100%, that is the range as we age. Okay, so I'm approaching 70. So if I just follow the statistic, I can be as low as only 25%, right? If I keep myself healthy, then maybe only down to 50%, but still half of what I used to have at 20. So we must, we want to be healthy, we must try to boost to the maximum possible. And if this describes your life, then your rate of decline is even definitely faster than the average. If you drink too much alcohol, you just don't sleep enough, you expose too much to the sun, what more if you're exposed to radiation, and you take many medicines, right? A poor diet, When you exercise a lot but not compensated with enough antioxidants, you smoke, right? That all sorts of, if you have chronic diseases especially, and also exposed to pollution, your decline may be more than 10 to 15% a decade. Indeed, most studies have shown that most diseases are associated with glutathione depletion because glutathione is used up as the body tries to fight these diseases. Okay, more than 100 diseases have been studied and found to be associated with low glutathione levels. So we would like to suggest that prevention is better than cure. Boost glutathione before these diseases appear, right, including the mental disorders. So how to increase glutathione? Glutathione taken orally is not well absorbed. So we need to supplement with glutathione precursors or boosters. And earlier on, I mentioned to you about glutamate or glutamic acid as one of the precursors. And at the beginning, I showed you the molecule of glutathione, which is actually made of 3 amino acids, glutamic acid, cysteine, and glycine. So that means there are 3 precursors. But scientists have found out that all you need to worry about is cysteine, because glycine and glutamic acid are abundant in our diet. So it's, unless you're really starved or malnourished, you are unlikely to be deficient in glutamic acid or glycine. But cysteine is the least